It's a clinic that was actually developed over the course of the pandemic now, and it's trying to reach an unmet need in the community in regards to people who have recovered from COVID pneumonias. There is also a need from referral physicians, so physicians in the community which actually have these patients and their patients after they have had COVID, a place that they could refer their patients for further assessment and then also therapies potentially. And from a community point of view, we're an academic center. We have several specialties that are not there in the community in the areas of cardiology, renal, GI, physical therapy, other areas. So right now what we have in our clinic, it's assessment by a pulmonologist. We're bilingual, also in Spanish speaking. And we do an assessment with a history and physical. We also do a full pulmonary function test. We do imaging with a CAT scan as well as blood work to determine whether there are any sequelae from having had COVID pneumonia. We'll do an assessment and we'll determine whether the patient requires any follow-up or do they need to be seen by other specialties. It's anybody who had COVID pneumonia, which has been actually proven by PCR testing or by antibody testing. And we expect that they're going to be people who are symptomatic. It could be either people in the inpatient or in the ICU that actually recovered, and even people who were treated in the outpatient setting. We always ask that the patient will be seen 4 weeks after they have been diagnosed, and then we determine whether there are any abnormalities that the person requires to either get a referral to another specialty. Within our pulmonary division, for example, we have specialties in COPD or asthma or pulmonary fibrosis, so we can refer them to those specific areas. And in the way that we have conceived the clinic right now, we have also the patients come back within a period of 6 months to reassess whether there have been any changes since the last visit. And as we learn more about this, we'll have a better understanding where are going to be the places that patients would benefit the most. Well, we have learned that actually the disease has consequences in the lung, and even in people who have been treated in the outpatient setting. We see some airway damage, sometimes an asthma type of features. We have also seen things outside the lung in regards to debilitating symptoms. People are not able to go back to work. Some inflammatory markers that they persist. And we continue to learn as we're having patients coming through the clinic. At this point, what we recommend is that they contact the university at medical specialty, at the hospital, the medical specialty clinic, and they ask for an appointment for their patient, which is every Friday morning from 8 o'clock in the morning until noon. And we have 8 slots every week for any patient who wants to be seen in this clinic. It can also be self-referral, as long as we know that this person has had a diagnosis of COVID basically on PCR or antibodies. This is the first time that we have had really a virus in the world that actually human beings have never been exposed to. So there is no adaptive immunity, and the constellation of symptoms as well as diseases that could happen from these viruses are unknown. And I think that what we're trying to do with this clinic is not only provide support, but also trying to understand what could be the consequences from having had COVID pneumonia. And in a rural environment also, we understand that the access to care is a limitation, and being able to be seen here at the university and have referrals to specialties, it's a resource that actually we think that the community can benefit from.